Hello friends, welcome to our channel. Today we are discussing about human disease called typhoid. This is an introduction towards the typhoid. It is an enteric fever, also known as a typhoid fever. Typhoid fever is an acute illness associated with a fever caused by the bacteria salmonella typhi bacterium. It is very important for the Neet, that word salmonella typhi, the bacteria that cause typhoid. It can also be caused by salmonella paratyphi, a related bacterium that usually cause a less severe illness. It is also important that salmonella paratyphi is also cause typhoid but not severe like salmonella typhi bacteria. Major cause morbidity and mortality. Food waterborne disease. The bacteria are deposited in water or food by the human carry and then spread to other peoples. This bacteria is carried by food and water. Causes of this bacterial infection include bacteria salmonella typhi, family Enterobacteriaceae, gram-negative bacilli, and best grow at temperature of 37 degrees Celsius. Transmission include facial oral route, close contact with patient or carriers may cause this disease. This is communicable disease. Contaminated water and food, flies and cockroaches also carry this microorganism or this bacteria which cause typhoid. Is typhoid contagious? Typhoid fever is highly contagious. An infected person can pass the bacteria out of their body in their stool or feces and less commonly in their urine. Urine also carry that bacterium. Contamination of water supply can and in turn taint the food supply. The bacteria can survive for weeks in water or dried sewage. This is very dangerous bacteria that can survive for weeks in water that cause typhoid. How do people get typhoid fever? Work or travel to area where typhoid fever is endemic, means common to that area, where the peoples are always affected with typhoid. Work as clinical microbiologist handling salmonella typhi bacteria. Have close contact with someone who is infected and has recently been infected with typhoid fever, means communicable disease. Drink water contaminated by sewage that contains salmonella typhi, means pure water is required for the body protection from this bacterium. How long is person with typhoid fever contagious? The person with typhoid fever is contagious anywhere from a day to years. It is very chronic. Chronic carrier. Chronic means for long time. Some researchers suggest a few individuals may be contagious indefinitely, means for whole life. About 3 to 5% of people become carrier of the bacterium after the acute illness. Carrier means after the typhoid is occur in that person, after that he become carrier or she become carrier. Their symptoms is not present in that person but they affect other persons. Others suffer a very mild illness that goes unrecognized. These people may become long-term carrier of the bacterium, even though they have no symptoms, be the source of a new outbreak of typhoid fever for many years. What is the prognosis of typhoid fever? With appropriate antibiotic therapy, most patients recover from this disease. However, 30% of the people who do not receive the therapy will die, means this is very lethal disease. Annually in the United States there are about 300 to 400 cases and only 1 or 2 deaths each year. Most of those who get sick have failed to receive a vaccination prior to travel. Typhoid fever kills hundreds of thousands of people annually each year. Most deaths occur in the developing countries. Our India is also a developing country where the disease is common. With adequate treatment, less than 1% of the victims should die. There is concern that multi-antibiotic resistant strains of bacterium are becoming more common worldwide. Multi-antibiotic resistance means that bacteria is resistant to many antibiotics given by doctor. What are the symptoms of typhoid fever? Incubation period is typically 10 to 14 days but can be longer and onset may be insidious. Symptoms are often non-specific, clinically non-distinguishable from other febrile illnesses. However, clinical severity varies and severe cases may lead to serious complications or even death. Clinical features of typhoid. Stage first week, slowly rising splendid fashion of temperature for 4 to 5 days. Temperature increases, rapidly decreases. Again, the temperature rises, decreases. Abdominal pains include stomach ache, myalgia, malaise, headache, constipation. Relative bradycardia means decrease in the heart rate. Stage second of the second week include signs and symptoms of first week progresses. End of the second week include delirium, complications, then coma, death if untreated. Rise in temperature is most common in all these stages. End of the first week, rose spots may appear on the upper abdomen of the back of the sparse curve. Splenomegaly, increase in the size of spleen, abdominal distension with tenderness, diarrhea. Stage 3 of third week include febrile become toxic and anorexic, significant weight loss, typhoid state, apathia, confusion, psychosis, high risk 5 to 10% of hemorrhage, blood loss, perforations may cause death. Stage 4 of fourth week, recovery period. If the individual survive for the fourth week, the fever and mental state, abdominal distension slowly improve over a few days. Intestinal and neurological complications may still occur in the surviving untreated individuals. Weight loss, debilitating weakness in last months. Some survivors become asymptomatic. Salmonella typhi carriers have the potential to transmit the bacteria indefinitely or throughout the life they are carrier. Paratyphoid fevers. The course tends to be shorter and milder than that of typhoid fever. On onset, it often more abrupt with acute enteritis. The rash may be more abundant and the intestinal complications are less frequent. Diagnosis and investigation. Blood culture include blood test, specific serological test, identify Salmonella typhi bacterium or identify Salmonella antibodies or antigen. Fluorescent antibody study to look for the substances that are specific to typhoid bacterium. Vidal test or ELISA test are most common tests for the typhoid fever. Urine and stool culture of second and third week. Marrow culture include 90% of sensitive unless until after 5 days commencement of antibiotics. Punch biopsy samples of rose spot culture include 63% sensitivity. Clot culture. Culture may be obtained from CSF, peritoneal fluid, mesenteric LNS, resected intestine, gallbladder, pharynx, tonsils, abscesses and bone. Serology, Vidal test. This is the most common test for typhoid fever. Vidal test Tube agglutination test. Detect O and H antibodies. Diagnosis of typhoid and paratyphoid. Test for H agglutins in a drier tubes and a narrow tube flocules at the bottom. Test for O agglutins in a Felix tubes. Chalky incubate at 37 degrees Celsius overnight. These are the various test tubes contain these antibodies. Specimen collection based on different phase of enteric fever, duration of disease, specimen examination and percentage of positivity. First week blood culture 90% positivity. Second week blood culture 75, feces culture 15, vital test low titer. Third week vital test 8 to 100%, blood culture 60%, feces culture. In third vital test increases, positivity increases, or feces culture also increases the positivity. Activity. Rest is helpful for the typhoid. Medical care include antibiotics, corticosteroids for severe typhoid fever, antipyretic for the fever. Diet includes fluid and electrolyte should be monitored, and soft digestible diet is preferable in absence of abdominal detention and ileus. Surgical cares include in the case of intestinal perforation. Antibiotic include chloramphenicol 500 mg, ampicillins, code. These are the some drugs. Resistance in many areas of the world, especially India and Southeast Asia. Fluoroquinon, ciprofloxacin, third generation, cephalosporin. These are many drugs. Azithromycin, alternative when fluoroquinolone resistant is present. Treatment should be continue for 14 days. Chronic carrier were formally treated for 4 weeks. 4 weeks include 28 days with a ciprofloxacin, but many require an alternative agent and duration as guided by antimicrobial sensitive testing. Cholecystomy may be necessary. This is all about typhoid fever, which is caused by the bacteria salmonella typhi. Thank you for watching this video. Please like, subscribe this platform, share to your friends. Thank you for watching.